Hi, everybody, and welcome to this round of Take 20 with the network. These 20-minute presentations are an opportunity for network members to engage virtually to learn from one another on how to build strategies, implement programs, and move our work forward.
Ciao. Joaquin.
So today we are hearing from Yesenia Silva and Hayam Magali from the Central Valley Health Policy Institute, who will present oral health barriers for California's San Joaquin Valley underserved and vulnerable populations. Dr. Marlene Benjamin, the project director, is also standing by for questions at the end and will be staying off camera if she can help it. So a few housekeeping items. This presentation will be recorded. I currently have everybody muted, but at the end you can unmute yourself and ask a question, or you can type into the chat box, which is on the right-hand side of the screen. So go ahead and take it away, Yesenia and Hayam.
Okay, hello, everyone. Today we're representing Fresno State Central Valley Health Policy Institute. My name is Hayam Magali.
And I'm Yesenia Silva.
We're sharing with you our findings from the survey that we had for the last 2 years as part of the grassroots engagement initiative, Oral Health. Our survey aimed to identify the barriers for California's San Joaquin Valley underserved and vulnerable population. This is an overview for our presentation today. And this is just few maps to show you where is the Central Valley or the San Joaquin Valley area in California. The San Joaquin Valley is this yellow part. This is the area that we live, Fresno County, and there are basically 8 counties in the Central Valley. The middle map shows the opportunity for adults to be graduated from college, and the red color indicates that this is the lowest ability or the lowest opportunity for adults to be graduated from college. And the third map shows the poverty level in the area, and the darker color it means higher percentage of poverty. This is the purpose of our study. The Central Valley Health Policy Institute is one of the 6 grassroots organizations in California, and the other grassroots organizations are these organizations. And we, as CVHPI, we do research, evidence-based research on oral health. That means that we use multivariate analysis, we use large sample of participants in our surveys, and we use regression analysis as well.
So just to give you context over how our survey was developed, we created the survey and also piloted. Our survey contains 20 questions, 5 about demographics and 19 about knowledge and attitudes of oral health. From that survey that we created, 3 subskills came from. One was about learning needs skill. The other one was about knowledge of unhealthy behaviors, and the third one was knowledge of healthy behaviors. And so through our project, we collected about 700 surveys at 4 counties across the Central Valley. And we did this at clinical sites and non-clinical sites. And our survey was created in English and Spanish. And so this is just a breakdown of our sub-skills and where some of the questions from a survey fit in those identified sub-skills.
In regards to our participants' characteristics, these pie charts shows the majority of our participants were Latino Spanish speakers, this red part of the pie chart, and also the majority of them were relying on Medicaid. These bar graphs also show our participants in regards to the insurance type and the ethnicity. So if you look at this bar, this bar, you see that most of them were Latino Spanish speaker, and the red part shows that they didn't have any kind of insurance. The light blue, they relied on publicly Medicaid, and few of them relied on private insurance. Most of our participants, regards to the insurance type and education, many of them didn't have a high school degree, and the red part shows they didn't have, among these categories, they didn't have any kind of insurance, and most of them, they relied on the Medicaid, and few relied on private insurance. During taking or collecting our surveys, the researchers had some observations. When we looked at the Spanish speakers versus non-English, the English speakers versus non-English speakers, the non-English speakers needed more help or more assistance while reading the survey question. Even they needed from the researchers to rephrase the question or use more examples to explain them. When we compared also the clinics and non-clinic sites, non-clinic sites, at non-clinic sites, the participants showed more willingness to share their negative experiences they had at the dental office versus the clinic sites. This table also shows some of the identified barriers that the participants mentioned in their survey. It showed that the most barrier was the cost, followed by the time to find, the ability to find time to go to the dentist or to schedule appointment to go to the dentist when they need it. There were also barriers such as transportation, handicap accessibility, fear going to the dentist, and also there were some language barrier. In the survey, there was an option for the participant to cite the barrier in their own words, and many of them, and these are examples of the barriers in their own words. And some of them cited that they didn't have the appointment when they needed. Some of them had a barrier such as insensitivity to their culture, and also they complained that some of the dental health providers, they didn't care enough about their needs. This table also shows some of the barriers. The cost here shows that it was the most identified barrier to oral health care, followed by time, by also fear was also identified, and transportation.
So when we look at the data that we collected, we found some key perceptions and knowledge of oral health from the participants that we felt was worthy of sharing with you all. Some were positive and some negative. So for the positive perceptions, we found that the majority, 99%, most of them agree that taking care of the teeth is important to their health. 96% of participants agree that regular visits to the dentist keep away dental problems. And 90% of participants agree that they would like to learn more about keeping their teeth healthy. So we found that all of them, the majority of them, agree that going to the dentist is important, and going to the also that they wanted to learn more about what was how to keep their mouth healthy. And so when it came to the negative perceptions and knowledge, we found that 50% of participants agree that dentists did not care about their culture and language. And then 37% of participants agree that dentures were less trouble than taking care of their own teeth, and 28% of participants agree that eating and drinking sweets does not cause tooth decay. And for us, those percentages were kind of alarming, since these perceptions and knowledge may put them at high risk. We took on our data and did some analysis on what were the key points or differences across the groups. And so we found that when it comes to learning needs, we noticed that Latino Spanish speakers have higher learning needs than the other two groups. And then when it came to knowledge of unhealthy behaviors, Latino Spanish speakers scored less, so had less knowledge of unhealthy behaviors. And when it came to knowledge of healthy behaviors and attitudes, Latino Spanish speakers knew more about knowledge of healthy behaviors compared to Latino English speakers and non-Latino participants. And so we also we took our data again and we found some interesting interactions. So these two line graphs, in these two line graphs, we want to emphasize in the square, the yellow square, which shows the Latino, non-Latino participants with private insurance had less learning needs than any other groups. English, the Spanish Latinos, and the Latino English speakers. So that was something very interesting to find. And then when it came to the unhealthy scale, we found that Latino speakers inside the clinics have a less scored less in the unhealthy scale, which meant that they knew less about unhealthy behaviors. So our next table shows a multivariate analysis, and this graph pretty much shows interactions between insurance type, site, clinical and non-clinical site, and the score they had regarding knowledge of healthy behavior. And so we want to emphasize in the red line across, and so this shows that Latino Spanish speakers, whether they had no insurance, Medicaid, or private insurance, they scored lower in the knowledge of healthy behaviors. So for us, that was kind of alarming in a way to find that even though Latino Spanish speakers have private insurance, they didn't got the same benefits that on other groups when it came to knowing what was bad for their oral health, what was bad for their mouth. And so these kind of made us think about oral health literacy, how much in one language people are receiving the oral health education, and in what modes they are receiving these informations. Since we would expect that in a clinic, the participants will have more knowledge, especially with a better insurance type. But it happens that in a participant's case, that was not their situation. And so I'm going to move on to the next slide. Okay.
Our next steps, based on these findings, we concluded as researchers that health literacy, or basically the oral health literacy, played a huge role in the knowledge for oral health and the oral health outcomes. Oral health literacy is defined as the ability to understand and apply health information to one's own health, and it can lead to better decision making. It's with the patient who has high level of oral health literacy, he has that kind of conversation with the dentist or dental provider that can enable him to understand and process the information and go back home with information that can help him to take informed decision in regards to oral health. It can predict that they will have better behavior in regards to oral health, and they will know what to do to keep their mouth healthy. So based on these findings, we plan to provide and to develop simple education materials that can be culturally competent and that will be also in different means in reading, visual, and audio, and also in different languages to match our diverse population in the area in Central Valley. On top of this, we also want to use or to benefit from the Promotora model or the community health workers because these individuals are working with their community. They are from them. They have this, they share with them the same language, same culture. So they can be a good link between the health provider and their community. They can simplify the information for them. We plan to provide a training, an oral health training for the prematura and community health workers to empower them and to help them to better help their community they serve. During the last year, we presented so many presentations like this to many community convening. And through these presentations, we try to understand the population. How did they perceive our findings? Did it match their findings, or did it match, was it relevant to them? Or they have different barriers that we didn't catch in our survey. Also, we plan to understand the needs of the dentist and the dental health providers in private and community clinics, to know better about the barriers they might have when they try to provide dental services to the community they serve. For more information, if you want to know more about our analysis or our survey, you can contact us with any of our emails, and we're going to be more than happy to answer your questions. Thank you.
Thank you. Do you have any questions?
Thank you, ladies. That was wonderful. So for anybody that does have questions, you can either choose to unmute yourself by clicking the audio on button at the bottom right hand of the Blue Jeans window, or typing a chat into the chat box that's at the top right of the Blue Jeans window. And so I had a question just to kick off as we're waiting for people to type, but have you shared these results with the clinics? I know it says that the plan is for interfacing with those clinics, but especially in the perception and attitudes of people that feel that their language and culture isn't either understood or cared for by the providers. Was that something you shared? And if so, what was the reaction from the provider side?
So we have reached out to the clinics that we work with that allow us to go in the clinics and take the surveys to share the information. We're still looking for dates so we can go to present to the staff, but we have reached out to a local group that provides dental care for teens, and we share the results with the staff who are actually doing the outreach and making sure that their clients are getting the dental care they need. And they see that many of these barriers are similar to what they see with the patients, especially with providing culturally and language competent, appropriate information. Most of the staff that they work with are Latino, Spanish speakers, and also Hmong speakers, and so they see that's a huge role in making sure that the parents are receiving the right information, and also the patients are getting to the appropriate services. So they see that our findings correlate to what they see in the practice when it comes to that. Yeah, we also reach out to one of the assembly members, the assembly member of District 31 here in California, and he also felt that our findings correlate with what he has seen in the community, that there's a high need for culturally and linguistically appropriate information, oral health information, and other health information as well.
Dr.
Yes. And so he's also working on a bill to push forward for more interpreters for medical patients.
That's great. I know we also have a Take 20 that was recorded back in April that was all about the use of community health workers, if that could be of any use to either you guys or anybody else watching this recording.
Yes.
So it doesn't look like there are any other questions unless if you guys want to stay on for a couple of minutes, if there's somebody that's shy to ask or typing one key at a time.
You can share that we're also on the advisory group of the GTI.
Yeah, and here in the Central Valley or in California, there is an initiative called Dental Transformative Initiative. And we're with Fresno County, and 11 counties are sharing this initiative. And Fresno County is one of them, in Central Valley. And here in the Central Valley, in the CVHPI, we are members of the advisory group. We attend their meeting and we shared with them our findings. And we help them to identify the barriers for the residents so they can start from these barriers and try to solve it. Because, for example, we told them that our participants are complaining from the transportation. So now they are trying to find ways to overcome this barrier and to find ways to help the participant or to help the patient to find transportation for the clinics. And also they find that they cannot schedule appointment with a dentist. They help them on that. They have they call them the dental outreach workers. They are almost like the community health workers. They are hired under the dental initiative. And these individuals, they help the patient to schedule the appointment with the dentist, to find the transportation for them if they have, this is the problem. And also they follow up with the dentist. How was the visit? Did it go well? What are the services provided? And stuff like this. So we help them in identifying these barriers.
Can Francis tell you how many?
Can you tell us how many people are in the webinar right now, maybe?
A few people have left right now. There's still 22, and I think there was about 30 to 35 at total. We'll know when the recording is ready. But I think that might be all that we have. There's more people dropping off now. So thank you so much, ladies.
Thank you, Francis,
Thank
for
you.
moderating. Thank you.